Dr. Michelle Askar, and in a moment you are going to be watching a video because you or someone you love is suffering with a chronic condition. Now, I want to explain to you what makes us different. I am a chiropractor, and what I am going to be talking about is not chiropractic related. We are not going to be talking about chiropractic adjustments. What I am going to be talking about is functional and metabolic medicine. We treat our patients both functionally and metabolically with conditions that you or your loved one may be suffering with, whether it be chronic fatigue, fibromyalgia, chronic neck or back pain, or even peripheral neuropathies. See, the traditional medical community does not do a very good job at this, at least in my opinion. Otherwise, you would not be here with us today watching this video. So once you understand that this is not about chiropractic and this is not about adjusting you, then you will have a better understanding, that this is a subspecialty that I have been doing for quite some time. You will also begin to understand how and why we are able to take a patient's health that is way down here and get them way up here. And how I'm going to do this is going through the different ways and explain how we do that in our office and what makes us different from any other doctor you have ever seen in the area. So most of the people that come to see us are heavily medicated. They've gone from doctor to doctor who've given them a symptom, and being given that diagnosis, they are given a certain medication. And after taking that certain medication, they end up with a new symptom, therefore given another medication. So, before you know it, those drugs add up, and it's not uncommon for us to see patients that are taking drugs, 20 to 30 pills at a time, coming in their 70s and 80s every single day, taking these 20 to 30 something pills. So there's something wrong with that, because all those pills are causing those symptoms. Now, it's not my job to take you off that medication. That's your MD's job. My job is to find out what's causing your health to go awry in the first place and get you to a certain level that you're not accustomed to functioning. So we see that quite often, and you have not had the proper lab tests that have been ordered, and we see it over and over again. And you haven't been tested properly with the new scientific research that is out there. The same information that your medical doctors have access to, and for some reason, they're not doing these tests. So we will put you through these tests, and that is my job, to find out what is causing these problems. So as I said, we will leave no stone unturned to determine the exact cause of your condition. Because see, in our office, we use metabolic treatments based on specific lab panels. We do a thyroid plant panel, we do a complete CBC with autodifferential, we do a complete metabolic panel, and we also do a lipid panel. We are able to assess your thyroid, your adrenal glands, your livers, kidney, red and white blood cells, and even the gut function of your body with all the above lab tests. All this can affect a chronic condition. So by addressing any of these problems with the thyroid gland, the blood chemistry, or gut function, we can help you heal a lot faster. The CMP, the Chronic Metabolic Panel, also allows us to check your blood glucose levels, since glucose and oxygen are needed by the brain to function properly. We also provide you with sensitivity testing, because sensitivity testing is used to determine if you have a sensitivity to gluten. And gluten is found in such things such as wheat, rye, oats, and barley. We will also test to see if you have a sensitivity with milk, eggs, yeast, and soy. If you are sensitive to any of these food groups, this absolutely is making your condition worse. If you have any of the following symptoms, then you can guarantee that you have an allergy to eggs, gluten, soy, milk, or yeast. So here are some of the symptoms that patients complain of typically. Chronic pain or fatigue, frequent indigestion, bloated after eating, frequent or loose bowel movements, constipation, mouth ulcers, even vomiting frequently. So if you have any of these symptoms, we must run the test to see if you have a sensitivity to any of these foods. We will also perform an ASI, known as an adrenal stress index, because with this test we can further test your adrenal glands with this test. The salivary test is much like DNA testing. Your adrenal glands are your stress indicators and stress organs, meaning they are the first to react to stress. If you have been or currently under stress, then this test is an absolute must. If you suffer from insomnia or blood sugar issues, this test will measure your cortisol levels. So when your body's level of cortisol is abnormal, you may suffer from insomnia or problems with blood sugar. Cortisol levels can be corrected through specific nutritional protocols. We will check the immune panels because, as you know, autoimmune diseases is whenever the body begins to attack itself, whether attacking the nervous system, your joints, the connective tissue, even the thyroid. So we test specific antibodies to determine if you suffer an autoimmune condition. We will run the immune panels such as lymphocyte subpopulation, cytokine panels, and the natural killer cell activity. The immune panels give me an in-depth picture as to what exactly is occurring with your immune system. If you're suffering from an autoimmune disorder, that trumps everything, and we must correct that first before we can correct anything else that you may be suffering with. Because your immune system makes up and is made up of two parts, Th1 and Th2. We need to find out which one is working and which one is not. Only then can we successfully treat your condition. We will also check your gut because we need to see if you're running a bacteria called H. pylori. This is related to gut function. We will also do an intestinal permeability test because we want to see if you're suffering from a condition called leaky gut. Leaky gut describes a condition where there's altered or damaged bowel lining caused by antibiotics, toxins, poor diet, parasites, or even infection. It can lead to increased permeability of the gut wall. Toxins, microbes, undigested food, waste are larger than normal macromolecules. It has been proposed that these substances affect the body directly, while others postulate an immune reaction as these substances. We check the neurotransmitters because we need to check and see if there's a decrease in brain neurotransmitters because they are a proper and vital, we'll try that again. We test for the decreased brain neurotransmitters because the neurotransmitters are vital for the proper brain function. Decreased neurotransmitters can cause increased pain. We're going to check your hormone panels. We check hormone panels to determine if the patient suffers from low testosterone in male and low estrogen or progesterone in females. Symptoms related to decreased hormone levels may include depression, fatigue, mental fogginess, mood swings, hot flashes, sweating attacks, weight gain, infertility, and even decreased physical stamina. And of course, we need to check the body for inflammation because if there's inflammation in your body, testing the homocysteine levels, the C-reactive protein, many of the patients suffering with these types of health conditions suffer with some type of inflammatory process. And my favorite, glutathione. We use glutathione in our treatment, especially for all the AI or autoimmune conditions, because glutathione is the motherlode of all antioxidants. See, glutathione cannot be taken orally in the form of a pill because the body will not absorb it. So we have seen miraculous changes in our patient population using this as a result of our specific protocols. Glutathione is especially helpful with autoimmune diseases. So again, in our office, we check our patients neurologically and metabolically. So the neurological treatments that we do are, for instance, oxygen therapy. Oxygen is the fuel to your brain and nervous system. Your brain and nervous system survives by two things, fuel and activation. And fuel comes in the form of oxygen and glucose. Our brain-based therapy protocols are used with some systems such as vibration therapy, non-surgical spinal decompression, and an interactive metronome. So vibration therapy helps fire the back part of the brain called the cerebellum. One of the functions of the cerebellum is to control your spinal muscles. So we may also use auditory stimulation, olfactory, and caloric stimulation to get that part of the brain to fire. Again, we use non-surgical spinal decompression because it creates a negative pressure in the disc that is bulging or herniated to remove that pressure off the nerve. It also provides a slow stretch to the muscles and firing up the spinal cord, which increases the firing to the brain. And lastly, an interactive metronome. It is a computer-based program that uses visual and auditory and even motor stimulation to increase firing of the brain. So once we have run the necessary tests to determine your specific condition, we can successfully treat you with the proper neurological and all-natural nutritional protocols. So you need to ask yourself the following question. How has your condition affected your job, your relationship, your finances, your family, and other activities that you've had to cut back on? What has this cost you in time, money, happiness, and sleep? And where do you picture yourself in the next 1 to 3 years if your condition is not taken care of? What is this worth to you if we could improve your condition? So again, I am Dr. Michelle Askar, owner and operator of Inline Chiropractic Clinic in the Beaver County Spinal Disc Center. I've been in practice since 1994, and I have successfully treated thousands of patients using the information that I've just shared with you on this video. So, if you finally want an answer of how to end your peripheral neuropathy, the numbness and tingling in your hands, arms, legs, or fingers, balance disorders, vertigo, infertility, chronic fatigue, if you want to end that nightmare, then give us a call at 724-774-5463. Or you could visit us on the web at www.spinaldisccenter and find additional information on YouTube. And when you're on YouTube, plug in Ask Dr. Askar. So, what you need to do next, if you're really serious about the possibilities that there could be an answer and a solution to the problem that you've been suffering with, whether it be you or a loved one, again, call 724-774-5463 with the opportunity to sit with me, Dr. Michelle Askar, knee to knee, to see if we can help you. This offer expires in 2 weeks.